blocked heart arteries are a serious health concern that can affect not only your heart but also your legs and feet. When the arteries leading to the legs and feet become blocked due to plaque buildup or atherosclerosis, it restricts blood flow, leading to a range of warning signs. These symptoms are often subtle at first but can escalate quickly, potentially leading to severe complications. In this video, we will go over 10 warning signs of blocked heart arteries in the legs and feet that you should not ignore. 1. Leg pain or cramps. Claudication. One of the most common signs of blocked arteries in the legs is leg pain or cramps, often referred to as claudication. This pain typically occurs after physical activity, like walking or climbing stairs. The discomfort happens because the muscles in the legs are not receiving enough oxygenated blood. If you experience leg cramps that subside with rest, it could be an indication of restricted blood flow caused by blocked arteries. 2. Cold feet or legs. If you notice that your feet or legs feel unusually cold, especially when they shouldn't, this could be due to poor blood circulation caused by blocked arteries. When the arteries in the lower extremities are obstructed, the body has a harder time delivering warm blood to these areas, leading to a cold sensation. If this persists, it is a warning sign that your arteries are not functioning as they should. 3. Numbness or tingling sensations. Another sign of blocked arteries in the legs and feet is numbness or a pins and needles sensation. This can occur when the blood flow to the nerves is restricted. Without proper blood flow, the nerves in the legs and feet may not receive enough oxygen and nutrients, leading to a tingling or numb feeling, which may feel like your legs or feet have fallen asleep. 4. Weak pulse in the legs or feet. A weak pulse in the legs or feet is a significant sign of poor circulation and blocked arteries. Normally, you should be able to feel a pulse in your ankles or feet when you check for it. If the pulse feels weak or you can't detect it at all, it suggests that blood flow is compromised, which may be due to blockages in the arteries. Slow or non-healing sores and wounds. If you have sores or wounds on your legs or feet that heal very slowly or not at all, it could be an indication of blocked heart arteries. This happens because your body's ability to deliver oxygen and nutrients to the wound site is diminished due to reduced blood flow. Slow healing can also increase the risk of infections and other complications. 6. Discolored skin on the legs and feet. When blood flow is restricted, the skin on your legs and feet may take on an unusual color. It can appear pale, bluish, or even have a reddish-brown tint. This discoloration is a result of inadequate oxygenation of the skin tissue, and it's often a clear sign that the arteries are blocked. If you notice persistent skin color changes, it's important to seek medical advice. 7. Swelling in the legs or feet. Swelling or edema in the legs and feet may occur when blood circulation is compromised due to blocked arteries. As the blood struggles to flow properly, fluid can accumulate in the lower extremities, causing them to swell. If the swelling is persistent, especially in the lower legs or feet, it could indicate a serious circulatory issue and should be investigated promptly. 8. Hair loss on legs or feet. A reduction in hair growth on the legs or feet can also be an indicator of blocked arteries. When blood flow is reduced, the hair follicles on the lower extremities do not receive the necessary nutrients and oxygen to sustain hair growth. If you notice thinning or patchy hair on your legs or feet, it may be a sign that your circulation is compromised. 9. Difficulty walking or performing physical activities. Arteries blocked in the legs can make it difficult to engage in normal physical activities, such as walking, climbing stairs, or even standing for extended periods. As blood flow decreases, the muscles in your legs tire more quickly, and you may experience a sense of weakness or fatigue. This can severely affect your mobility and overall quality of life. If you find yourself struggling to perform routine activities, it may be time to consult a healthcare professional. 10. Erectile dysfunction in men. While erectile dysfunction is typically associated with problems in the pelvic region, it can also be linked to blocked arteries in the legs and feet, The reduced blood flow caused by blocked arteries can affect not only your legs but also your ability to maintain an erection. If erectile dysfunction occurs alongside other symptoms of poor circulation, it could be a warning sign of cardiovascular issues. 11. Chronic fatigue. If you find yourself feeling constantly fatigued, especially in your legs or feet, it may be related to blocked arteries. Restricted blood flow means that your muscles and tissues are not getting the oxygen and nutrients they need to function efficiently. As a result, you may experience overall tiredness or weakness in the legs. This can make even routine activities feel like a struggle. If this fatigue is unusual or persistent, it's worth consulting a doctor. 12. Burning sensation in the legs or feet. A burning sensation in the legs or feet can indicate that the nerves are being affected due to restricted blood flow. This feeling can range from mild to intense, and it's often accompanied by other symptoms like numbness or tingling. If you feel a burning sensation that doesn't go away or worsens with time, it's a sign that your circulation may be impaired and needs to be evaluated by a healthcare provider. 13. Increased sensitivity to temperature changes. People with blocked arteries in the legs and feet often find that they are more sensitive to temperature changes. This could mean that your legs and feet are much colder in cold weather, or even feel uncomfortably hot in warmer conditions. This abnormal sensitivity occurs because your blood vessels are having difficulty regulating temperature due to the reduced flow of blood. 14. Foot ulcers or skin changes. Foot ulcers or changes in the texture and quality of the skin are a concerning sign of blocked arteries. When the blood flow is restricted, the skin may become more vulnerable to breakdowns and ulcers. These ulcers are often slow to heal and can become infected if not treated properly. The presence of such ulcers or noticeable skin changes on your feet requires immediate attention to avoid complications like infection or even tissue damage. 15. Aching legs. When resting, while it's common to experience pain during physical activity, experiencing aching legs while resting can indicate a deeper issue with circulation. If your legs hurt or feel heavy when you're lying down or not using them, it could suggest that your arteries are not supplying enough blood to the muscles and tissues, even during rest. This is often a more advanced sign of blocked arteries and should not be ignored. 16. Leg or foot weakness. If you notice muscle weakness in your legs or feet, it can be a result of reduced circulation. Blocked arteries can prevent the necessary oxygen and nutrients from reaching the muscles in your lower extremities, leading to weakness and difficulty supporting your body weight. If you have trouble standing, walking, or lifting your feet. Conclusion. Blocked arteries in the legs and feet are often a sign of more significant heart health issues. Being aware of the warning signs, leg pain, cold feet, numbness, swelling, and wounds that won't heal, can help you catch the problem early and seek the necessary treatment. Remember, these signs should never be ignored, and seeking medical care as soon as possible can prevent serious complications. Stay alert and take care of your circulatory health for a better quality of life.